everyone and welcome back. For those who haven't watched the previous video or still don't know me, my name is Dr. Alex Goichman and I'm the principal dentist at the dental team that cares in Balaclava and Malvern. Today I want to talk about COVID-19, sunshine and some lessons from our past. So I hope that since my previous video everyone have been keeping well and maintaining some degree of sanity. Since my last video I've been receiving many positive feedbacks about the health tips. However, some people have also asked what else can they do to stay healthy during these times. So I decided to do this second video because I came across an interesting article. In this article, a research group was trying to explain the difference in the severity of COVID-19 outbreak in different countries. Not on a personal level, but more on a country level. They were looking at China, Hong Kong, Singapore, Korea, and Italy. Looking into demographics, average age of population, climate, trying to explain the difference in the severity of the outbreak based on the information we know so far, which means aging population poses a higher risk. More dense population, again, a higher risk, and colder climate seems to be a higher risk compared to warmer climate. Now, obviously this group didn't look into the different health systems, which again will make a difference in the severity of the outbreak, and also obviously different countries manage the outbreak differently, which again has a direct effect on the severity. The country which puzzled this group the most was Italy, because the average profile of the population throughout the country is fairly similar. However, North Italy has a severe outbreak, whereas South a very mild outbreak. The group noted that in North Italy the winter is colder compared to the South, and the outbreak did start in February, which is the end of winter. But then the group theorized that maybe cold winters or ambient temperature by itself can't explain the severity of the outbreak, and they need to consider other factors, temperature-related factors, which can shed light on this extraordinary difference. Can it be that in the warmer south, where people spend more time outdoors, their immunity is also better? Can it be that sunshine, which is a key factor in our physiology and among other things will trigger the production of vitamin D in our body, is also a factor to consider? This made me dig deeper and read more. I found that on the 23rd of March, an interview with the former CDC director, Dr. Tom Frieden, claims that reduced vitamin D levels can increase the severity of COVID-19 symptoms. Reduced vitamin D levels can increase the severity of the symptoms. Now, we know that the severe symptoms of COVID-19 include an acute lung inflammation, which triggers something called a cytokine storm. So what is this cytokine storm? In a normal situation, our immune system will identify a virus-infected cell and will destroy it. However, in a cytokine storm, the lungs are heavily infected by viruses, and this immune system goes out of control, and as a result, the lung can basically shut down. Now, in this condition, if it's not treated, and unfortunately this serious condition, even if it's treated, can result in death. So I dug deeper and read more and found more articles and more paper suggesting that vitamin D is a factor component in suppressing the so-called cytokine storm. I continued reading more and found that basically this knowledge is not news. It's actually old news. Because back in 1918, during the Spanish influenza, which killed approximately 50 million people and infected roughly about a third of the population of the world, they found that the major cause of death was severe pneumonia with symptoms very similar to what we call a cytokine storm. Now, you need to understand that back then people didn't have modern medicine or biogenetics or even clever algorithms to predict the behavior of this and that disease. Back then, viruses were basically only a concept because they were properly discovered only in the 30s. So back then, people relied on past knowledge, past experience, and trial and error. They found that what works, what reduces the numbers and reduces the symptoms of the disease were meticulous hygiene, facial protection, social distancing, communal isolation, and something called and open air therapy. Now, back in 1918, many of the sick came from the densely crowded troop carrier ships and army bases during World War I, which World War I was known for its brutality and low hygiene. Medical staff noticed that whenever possible, if they allowed the sick and the wounded to stay in the sunshine instead of the closed hospital wards, then death rates have dropped from something like 40% to roughly 13%. That's almost 3 times fold drop in death rates. Now, talking about Spanish flu in 1918. Now, it is a different virus. It's called an H1V1, which is similar to our influenza virus, which we are immunized almost every winter. But the treatment is similar. And eventually what cured the world was herd immunity, where the majority of the population got infected, healed, and the virus basically have no one else to infect. So, what is vitamin D? Vitamin D is a group of fat-soluble steroids. They're basically more hormones than vitamins. We know that vitamin D participates in our calcium metabolism. We also know that vitamin D levels decrease with age and are lower in people of older ages, but they're also at a higher risk of COVID-19. We know that vitamin D is an activator in our acquired immune system. That is our immune system, which is responsible for defending us from secondary infection and reinfection. We know that low vitamin D levels are associated with respiratory infections. So, for those of you who are still interested in reading more about this topic, I've attached a few links at the bottom of this email. Hope I was able to help. Let's stay in the sun about an hour a day, keep our hand hygiene, maintain social distancing, and hope for herd immunity. Stay safe, and next time we'll talk about COVID-19, malaria, quinine, and gin and tonic. Cheers, stay safe, till next time.